help people make those decisions. And what we've got is a session where Peter Wells, a friend of ODI Leeds, used to be with ODI HQ in London, now is usually walking up and down the beach in the northeast somewhere. Peter's, I'm hoping I'll fill in while Peter joins us. I did speak to him yesterday. He's going to set some context around data, local data, what he's been finding, and then ODI Leeds, we've just set up a quick Google document, which Amy is going to share in the chat now, where people can, if they'd like, share who they are, where they're from, why they're here, what they would like to do, but also if we can start capturing some use cases in here that we can light up. And then in our inimitable, helpful, friendly way, we'll communicate then to our sponsors that include NHSX, NHS Digital, local authorities. And then that will then be a resource for everybody and anybody to use as they communicate with people to understand what's going on. So yeah, we're doing that. So I am just going to classic online session. I'm going to beep Peter and see if he is here. So first way is a Twitter DM. See if he's there. So one of the areas that we've been looking at is how do we help with presenting local data to our sponsors, our ecosystem, the people who are interested. And what we can do is present information on hex maps. So we're going to fill and switch things around a bit while Peter gets back online. So Stuart Lowe, who works in our data projects, has been working on visualizing our data at local authority level from lots of different aspects. And if you've been following me on Twitter, you see me moaning about how if I was in Italy, I'd be able to understand a lot more data. Or if I was in France, I'd probably understand a lot more data about what's happening with COVID. But Stuart's just going to show you some of the work we've done to present data at a local level, and also where we found that data and how we might improve this so that if we were to present our own information or people locally will have a specific question, we'd be able to respond to that, as well as having a central set of communications. So Stuart, if you could just talk us through what you've done. And I've just had a message from Peter. He's his Wi-Fi has fallen over. So yeah, classic online session. So Stuart, if you can just talk us through what we've done to visualize the data, where we got the data from, and also if people want to make comments about this, they can in the chat, and also say where we might suggest some improvements about how we'd be able to use the data to communicate people about the risks and how they might respond to COVID. So over to you, Stuart. I'll go on mute.
Okay, I don't know if you can see my screen or not. Hopefully you can. Someone let me know if you can. Okay.
We can.
So this was the local authority dashboard that we made. We started with a hex map, and we added a graph on the side here, and we've got a timeline down at the bottom. You can see some of the data ends up being a bit patchy. Now, we initially started with the Public Health England data, but then they changed their website and got rid of the static files, and they sort of tried to put those back with some JavaScript, and people have tried to work around that. In the meantime, because of all of that, I switched over to entirely using Tom White's collated data, so underneath these hex maps. So let me just say, a hex map is just a nice way of giving every local authority the same area on the visualization. Because some local authorities are very tiny and some are very large in geographical area. So it makes them all visible and doesn't hide some of them away, especially in London where they're all quite small geographically, not in people. So underneath each of the figures is linked to the data source, which is Tom White's compiled data. That's, hopefully you can see this page. this tab, which has my description of what we've used. So there's a link to Tom White's UK historical data. He's compiling it for England, Scotland, Wales and Northern Ireland. Public Health England have geographic breakdowns for parts of the country, but not all of the UK. So Tom's is really been the best place consistently to get a full picture of everything across the country at a local level. And that local level varies depending on which nation in the UK. So in England, it's upper tier local authority. In Scotland and Wales, it's health boards. So Tom has a full description of that on his GitHub repo. And I also made a note of where we got populations from. We've had to get things from different places, population estimates. Not every upper tier local authority as it stands in 2020 has a 2020 estimate of population, because those were done previously before certain ones of them existed. So I've had to get population estimates for previous years, but they do a good enough job. So that's where those data come from. Underneath the hex map near the bottom, there's a link to more hex maps. So each of these are different things, and some of the hex maps, it's not necessarily obvious, but I've had to use 2 different hex maps for different years worth of local authorities, because things have changed local authority wise. Some of them no longer exist, some are merged and things like that. So we've got a hex map for confirmed cases per capita, and just an interesting one on fraction of key workers estimated by the ONS, taken from an Excel spreadsheet from 2019. Well, it was issued this year, but it was about 2019 data. Then I've also taken the ONS registrations of death and done an all deaths per capita and a COVID-19 mentioned in them deaths per capita, and then a COVID-19 as a fraction of all deaths. Each of them will tell you a different picture. As you can see in the all deaths, perhaps coastal regions have more deaths. COVID-19 deaths, obviously there's some in parts of London, and then as a fraction of all deaths, maybe that's giving us a handle on excess deaths at the moment. Given that we don't have excess deaths by local authority, that might be a better proxy, the COVID-19 deaths as a percentage. So again, there's links to where the data comes from underneath each of those. And another thing I did was make sure that each of these hex maps was available as a static SVG after URL. So there's the URL, and so if you want to, you can get the latest SVG and embed it in your site somewhere else. You just use the URL in there. That's it really. Unless Paul has anything else to add.
No, thanks, Stuart. And we wanted to show that as an example. Right from the start, we've been trying to find and show local data, and it came as a specific response from Tom Rudhin, Chief Exec at Leeds City Council, and Theo Blackwell, CDO at the London Mayor's Office, is just, can we show some of this locally? And we've been building and working on this right from the start. Stuart, just could you, if you were going to, in a perfect world, what would you like to see so that you could build something like this for anybody in terms of the data infrastructure we'd need?
Well, one thing is it would be nice to have UK-wide data published by somebody, rather than it being done on a voluntary effort. In a more detailed sense, having an idea of what year the local authorities refer to, because names change. Use ONS codes for local authorities rather than just text, because it's amazingly hard to try and match all the random ways people type local authority names. City of York, York City of. Trying to match data in an automatic way, you could do it by hand, but doing it in an automatic way gets quite tricky given all the variations of local authority names. So use the ONS codes and say what year those codes refer to. Publish at fixed URLs so that people can automate grabbing of data. So don't constantly change the URL of a file, because that makes it very hard for anyone who wants to try and do anything useful over time to do something with updating data. I have to constantly work out what the new URL is. So I think that's my basic things.
Great stuff. And if there's people online who would like to see different data published in this format, please let us know and we'll do our best. And also we'll write this up post this session as we did with geography last week. I don't know if you've seen it. We put up a blog post around the improvements to geography. We're going to write this up and put a blog post up before next week's Open Data Saves Lives. Stuart's points will be in there, but also if anyone wants to contribute to the Google Doc about how they would like data presented, we're trying to build a design pattern for that with it here. And I know a lot of people want data at ward level or some what would be a sub local authority level that would make sense. So there's some thinking about that as well. And I know Jessica's on from NHS Digital. They're looking for use cases so that they can publish data that's useful for people to use. So let's work on that. And Dan Cookson, just let us know that.
To pick up on Dan, that's exactly the data that is being used in those 3 bottom hex maps. Is the ONS local authority level data. It covers England and Wales. So that's exactly
great stuff. Okay, so please add some questions in the Google Doc or the chat and we'll pick them up at the end. If you've got any suggestions about other data we could visualize, that would be fantastic. Peter has joined us now after, I'm sure his Wi-Fi fell over just as he was joining and was going to join us today. That's part of the jeopardy of these sessions. So Peter, over to you. If you can tell us about what you've been doing, what you've been finding out, and then afterwards I'd like us all to join in about contributing about what we'd like to see happen next. Over to you, Peter.
Thank you. Can you hear me? Checking the Wi-Fi is working. Excellent. I'm just going to try and share something. Technology, I love it on all the different apps. I'm not going to share anything. Because it's going to go wrong, I can see already. Sorry, how on Zoom do I share my screen? Can someone tell me what button to press?
For me, there's a green button at the bottom next to participants and chat that says share screen.
Cool. Mine says share whiteboard, share OneDrive, share Google. I just thought
you might need to be made host before you can share your screen.
Paul would never trust me with that power, which is very wise of Paul.
No, I think anyone can share the screen. Amy, where
cool.
are we at there?
Right, I am the co-host now. I have power, but I don't see a new option. I'm not going to try and do it now because I'll break it even worse. I'm slow it all down even more than I already have. Instead, I'll start talking. So I wanted to talk about, so some of this stuff is fairly obvious, but this is kind of, I suppose, the discussion I've been having with a few people, so it's good for me to practice saying out loud to people who also know lots of this stuff. So at the moment, when we look at coronavirus, if you zoom out, it's talking to the press, and most of the focus is on the scientists and on national governments. Okay, so when a pandemic starts, and we've got the World Health Organization, loads of national governments, loads of scientists working on bits and pieces. Then in national government, we've got places, we've got DWP doing their stuff, we've got Treasury doing their stuff, supporting individuals and businesses. We've got NHS and all of its DHSC, Department of Health and Social Care, and all of its various sub-bodies like NHSX, NHS Digital, Public Health England, etc., doing lots of stuff. Now, there's also local places doing stuff. So when I look at myself, I live in, those who don't know, I live by the sea, and I'm very happy about living by the sea. So I live in Whitley Bay. And in Whitley Bay, if I was short of food because I was isolating, the food bank, Whitley Bay Food Bank, will be dropping food around my door. I might be contacting VODA, the North Tyneside Volunteering Service, because they're the one who are organising most of the volunteering in the area, not the NHS Volunteer Service. It's VODA doing it, who work with the council, work with the food bank, work with the local health trust. The local coppers come along, and they're the ones who clear me off from the seafront if I happen to sit down and start reading a book. Because at the moment they say, please don't sit down and read a book, mate, move along, keep moving. It's the mutual aid group in my street who who are helping people who don't want to go to the volunteering service or the council or the coppers. So most of that stuff is happening at local places. And as we're moving to this point where we're starting to relax the lockdown, more things happen at local places. So that local authority starts to say, how, and this is happening across the country, how do I stop a potential outbreak before it gets too far? How do I help businesses who've been closed down? How do I help them get restarted? How do I help people who've been furloughed? How do I help, all of those different bits and pieces? Local authorities play more of a role at this stage of the pandemic than they've done in the past. And to do that, those local places are looking for information. So, as a local authority, they want to know how can they detect if there's a potential outbreak in their area so they can try and stop it. The ways they might stop it, when you talk with them, as I have been doing, they might say, if we think there's an outbreak in this tower block, we might stick some hand sanitizer at the bottom. We might put some posters up reminding people to wash their hands. If we know which businesses are receiving financial support right now and when it's going to get cut off, we can get in touch with them if they're critical and start to see if they need help. Or we can tailor our service so businesses can contact us. We can put out the right messaging for them. Food banks and volunteering services want to know where people are isolating so they can optimize their things. If the number of people isolating is shooting up, then the food banks might want to get on the phone to where they get their food from, which is from individuals and from nice places like Morrison's and Greggs, who are really good suppliers to food banks in this area, and say, can we get a bit more food in because we've got a lot more demand at the moment. But at the moment, all of that information that could help inform that is flowing up into the centre in a one-way fashion. It's not coming back out in a granular enough level to help inform those decisions. So, local authorities, they're actually starting to do, when you chat with them, they're starting to do things like, so one local authority last week, who I'm not naming publicly because they haven't said please name us publicly, was saying they've been talking with various authorities in their area about launching their own symptom tracking app, because the symptom data that's available isn't good enough to actually help them spot outbreaks. And that's them, their public health, they're working with their public health authorities, they're working with their local hospitals, but the data's not timely enough from there. The symptom tracking data that's coming out from central government is at too high a level. So NHS Digital publish it at clinical commissioning group level. Project Oasis thing, which is pulling together all of the symptom tracking apps, doesn't publish anything at all at the moment. And no one knows where that, I can't quite find out where that's going. So they're saying, we'll have to build our own thing to start to do this. They might even, one place is talking about doing a great vinegar test of getting all the population to sniff a bottle of vinegar and see if they've still got a sense of smell and use that to spot, to see if they've got any outbreaks and where they might be. Bit whiffy, but these are the things they go to. Testing data again isn't coming back at all. It's coming out at a high level region, and the national debate is driving it more towards data which is useful for public information and the national media. I'm glad that Mark loves vinegar. The person I'm very nice and a nice little premium balsamic vinegar on my salad when I have salad, which is very rare. As anyone who's met me can tell, I won't get distracted like I always do. So the testing data isn't coming out at the right level. Similarly, GPs don't actually know if patients on their books have been tested and what the results are, because the data is not flowing through at that granular level, because local authorities have checked with their GPs and said, the NHS ain't giving us this data, can you? And the GP saying, we haven't got it either. But because it's not flowing through at that level, when it does come out, it's likely to be the next release is going to be at the national level because it's being dominated by political complaints about volumes of tests, etc., etc. When local authorities say, if we knew 2 people are tested positive in a tower block, we might, take some action on top of that. It's also one way. we need to chat around on the concerns, and I've got a few calls in the diary with various people to start unpicking this. So you see that political concern, and that political debate that's happening around some of the data. There's a privacy concern. Some of the debate about privacy has gone, and one of my facets is being a privacy activist. It's gone way too far into privacy concerns. Lots of debate in the UK, and government are responding to that. So when you talk to people in government, they do seem to be prioritising privacy above public health in some places. That can be a bit of a concern. I wouldn't say privacy schmivacy, but there's ways to balance these things and there's ways to address these concerns. The priorities, central government, there's a lot of civil servants who are working flat out and trying to prioritise local needs against the needs of the national needs is hard. The pressure people are under, people have been working flat out for months in central government, and I'm incredibly conscious of, and central and local government, sorry, I'm incredibly conscious of the pressures some people are under in trying to do that. And then processes. So I managed to find an email address that you can request data from the COVID-19 data store, which is mostly in the press as the Palantir and faculty data store, but it's where NHS is shoving lots and lots of data and doing lots of models and dashboards for the centre. I found an email address to request access. I got sent back a 15-page form, which was version 13 of the form. I got sent a system to sign up to, which requires NHS email addresses. I was told even if I was given access, or anybody else was given access, all that would be provided was a dashboard, and that no one would be able to download data from the dashboard. Because that's somehow where things have ended up around that space because of all these other pressures. And unpicking some of that is going to be tricky and sensitive and all those kind of things. And if we were to get some of that data, we've got to be realistic that just secure, sorry, and I'm not the only person saying this. If you look around, you find political leaders saying it. Andy Burnham's been saying it a lot. Steve Rotherham in Liverpool's been saying it a lot. Councils, public health directors are all saying this kind of stuff through various different levels, and we need those different debates to try and pull it out. But there's a thing as well that people like ourselves will be realistic about. Even if we can get the local data to the local places, it doesn't mean it's going to solve stuff. There's going to be challenges there. So there's lots of people looking at modelling in local places. So there's a group in Durham who've been doing modelling on their place. There's a firm called Deck Zero who was producing and publishing local R models for quite a while. And some of that data has turned out actually not to be that useful, if even misleading. So I had a chat with Deck Zero. They stopped publishing the data because they could see it was being misleading and was damaging people and their own brand. So they pulled one of their dashboards and their data feeds because they could see it was going wrong. We can see that the data, if we get some of this data out, it might cause harm. So one of the famous cases is in South Korea, where data about where outbreaks were happening was linked to the gay nightclub scene. And South Korea can be quite a homophobic society, for those who did not know. And that's caused a backlash against that community. You can see some of the things happening if you look in France, in New Zealand, lots of other places have had some similar issues like that. So you need to think about and balance on those harms. And then will it actually do anything? So you talk to these places and they say, well, I might stick hand sanitizer in the lifts, I might put a public messaging campaign on, I might give more guidance and education, but we might find those things are actually unhelpful, or they just don't do anything at all. It's the classic case, is an analogy we use by government. You just pull the lever and the lever doesn't do anything, or it works in Leeds because people in Leeds do listen very carefully to their local authority, but it doesn't work in North Tyneside because we're a bit more rebellious and anarchist. So we've got to be convinced that we've got to work out how to do this well and not overpromise, I suppose, and be aware of the harms of the harms. I'm also hearing concerns around funds. So some places have faced challenge in getting funding when they have managed to get access to data. Transparency, is this stuff, can we get this stuff? Can we avoid some of the mistakes we're seeing at national government? around the lack of transparency. Can we work there properly, persuade people to work in the open? And is there local capability? I suppose I'm actually less concerned about the local capability, because when I'm talking to places, it's astonishing how many people have crowded around local places to try to help out. So that's been a really good thing to see, but you know, there can always be that capability challenge. So for me, I'm just wrapping up and then getting on to what's next bit. You know, it's about, so if we're getting started on this, it's, and if you see my slides, I've got to evaluate, it is going to be about starting with a need and starting small. It's going to be about working in the open. It's going to be about, you know, demonstrating and being actually trustworthy with all of the rich characteristics of things around trustworthiness, honesty. And for me, on the trustworthiness stuff, just go back to Baroness O'Neill, if anyone's not listened to her lectures on trustworthiness. At the moment, we're in that place where we just need the foundational values of trustworthiness, honesty, competence, reliability. And then keep evaluating and iterating. So keep our eyes open, keep evaluating to work out, is what we're doing, is what's happening, doing what we expect, is it useful, what can we learn, and iterate with some fast feedback. But it comes from starting with that need. I say the one I'm getting most immediately, and where there's in at least one council who aren't on the call but might have been, they're certainly saying if, and that's a council which is linked to multiple councils in their area in the northeast, if there was data about either tests or symptoms at 3 or 4 digit postcode level, then they could start using that and forming some of these feedback loops very, very fast. So they'd be willing to work in the open, they're willing to do feedback loops. But starting quite small with that and looking at that local lockdown, that local relaxation, and stopping new outbreaks before they occur is something we could tackle reasonably fast if we could get either symptom data or testing data at 3 or 4 digit postcode level. One final thing, if this doesn't happen and we don't start getting the data from central government, places are starting to look elsewhere for other sources. It's not just building their own apps, it will also be sources from the private sector who are starting to offer proxies for testing and symptom data. So there's people out there in the private sector who are starting to say, we can see who's going to testing centres and we can see where they came from. We can see, we might be able to spot symptoms because of all of the silliness like web searches and things that we've seen happen before. So we can start seeing lower quality data unless we can get that good quality data that's already in the public sector to the local places who need it to hopefully try and save some more lives. I'm done and I'm going on mute now.
Thanks very much, Peter. Oh, my internet connection is unstable, but we'll carry on. Thanks very much, Peter. Hopefully, there's loads of comments in the chat, which is great, which is exactly what we want. I'll just put something in there. There's Stuart's mentioned would LSOA level work as well as an alternative to postcodes. So I think there's something we can feed back on about people. If you were on the geography call last week, so postcodes can cause problems around licensing and shape and sizes. So maybe we could make some technical requests to people so that the data can be used more easily. I'm seeing Graham Hyde nodding his head there, and getting that set up. We can make some technical suggestions. There's also a point around setting some precedents. So if something works in Liverpool, and we know it works, and it's been through the IG and it's been signed off, let's share that widely so everyone else doesn't have to make that same decision and worry about things unnecessarily. And there's a lot of people, Mark Farr's point about give the data back. So there's a whole industry, people are filling in forms, creating status reports, you know, and then they're all being sent to the centre and nothing comes back. So it's a little bit Kafkaesque. And that, I think there's a demand for anything you share, you should see everyone else's version of that data, even if it's not published, not shared publicly, but you as an official authority or body have permissions and authority to look at that data. So why can't you see it through elsewhere as well, and then start to make your own decisions, which is really important. So hashtag give the data back is, and it shouldn't be hard for that. just before we go on, next week is all about tools and sessions. So I know that Beautiful Information have built some tools to collect this and share this back. So we're going to hopefully see some of that in action next week. And we've also seen some other tools that built by FutureGov, and we've actually hoped we might even have some people from in universities who are building models based on real data as well. So we're sharing that as we go. There's the chat is brilliant. We're just so you know, we are recording these sessions. We will take a copy of the chat and publish that. Peter, as you might say, he's also got a blog post that's going to go up live after this that we'll put on the Open Data Saves Lives page, and you can repeat everywhere and use again as an asset and a resource that we can use as well. So what I'd like to do now is open it up a little bit, and Peter linked to some use cases there. I'm going to add the technical suggestions use case into the Google Doc now. But also, if there's anyone else would like to make a comment or a point, either physically raise your hand or use the Zoom to make it to say that you like to make a point, and then we'll come to you. So, would anyone like to jump in, make a point, share some data? It does look as if we're going to get some data from ONS tomorrow, MSOA level. So that is quite interesting. We'll see how that goes. Catherine's got a hand up. Anyone else got? We'll do. Anyone else want to make a point? Anyone else got a hand up? Okay. So it's like getting the band back together, isn't it? Catherine Corrick, would you say who you are and where you're from, and just have a chat?
Catherine Corrick. I work with Frank, who's also on this call, and we do data protection, but I've also, as Paul knows, got background in open data, and also know Peter and probably other people on this call. So I think there's a question here on whether this is just, to what extent are these problems for England, and where are the problems are also for Wales and Scotland, and UK-wide, because I think that's going to be quite important in identifying. Because Scotland and Wales are doing actually a pretty good job at their local data, whereas as we've been discussing, England has some specific issues. So where I'd like to understand, where is it that everyone can help? You know, what areas does everyone need help in, and what are just specific to England, and then how to prioritize that? That makes sense.
All the stuff I talked about was specific to England. Yeah, very, very different in Scotland, Wales, Northern Ireland. The blog post says that. I just got to say that. I'm stupid.
Yeah, absolutely. And I think
it has a Scottish good blog on.
Yeah, and for anyone who's trying to go on holiday in Wales or Scotland, they're trying to make decisions as well. So it's a very interesting times. Stuart, the Tom White's repo, he collates everything, which is another, it's madness, isn't it? That we've got a very capable hobbyist pulling together the best collection of data for the UK for us. In the times of the pandemic.
Some of the hobbyists also doing similar jobs. It's just he was the one I found quite early on, so I've stuck with him.
Yeah. But he pulls together all of the data, doesn't he? And I think maybe after this, there's a point to maybe get someone in Scotland or Wales to do a job that Peter's done, just to get the lie of the land, which would be interesting as well. I do know, obviously, Tom Ford from ODI Leeds has done a comparison between England and the UK and France, which is a bit disappointing, really.
Public Health Wales have actually got a really good site. They use Tableau, and they've broken down a lot of this data. So that's why I'm just trying to figure out, are there commonalities where either there's problems being solved in Wales and Scotland already that could be used for England, and vice versa? Are there problems that all the nations share, such as some of the geographical issues? Some of this as well is partly to do with how devolution has worked, where actually there's more of a consistency in how governance and government work in Wales and Scotland, and the consistency of levels of government, which aren't which England doesn't have, because it's got way more variety in how government at local level works. So we've got mayors in some places, not in others. We've got parish councils in places, but not in others, etc. So there's quite a lot of challenges that this is one around as much about devolution as it is about and the data related to that and how things have changed. At the same time, there are lessons that I think, you know, England, that Scotland and Wales have solved that perhaps England could be learning from.
Great stuff. Yeah, absolutely. So, Catherine, if you could just drop a little comment in the Google Doc on that, that would be fantastic. And what we want to do. Would anyone else like to make a point? Or so Nick's got his hand up there. Most people have turned their video off, so I don't know if you're holding your hand up or not. And I'm sure Mark would like to make a point at some point on how we might move this forward. So, Nick Garrett, if you'd like just to.
Yeah, thanks. I run a community support organisation in North Yorkshire. I think, and some of you know, I did work in Leeds for council for some time before that, and I think the difference between different councils is probably as much about how much they think about place-based thinking and how much that is in their approach, and then that follows through in terms of a data strategy. So in North Yorkshire, because they think in quite a vertical sense, especially in children's services, it's quite hard to get information out of them that links to a place. So we're in a situation trying to deal with food poverty and food insecurity, trying to work out, you know, how many people are eligible for free school meals and stuff. It's really hard doing that in an area where they're not thinking in terms of place. So it's just a comment on the culture, really, that perhaps sits behind the reluctance to release data.
Okay, so my objective is to try and finish these sessions under an hour. We've got 20 minutes left. People are sharing things in the chat. We've got the open Google document. We're moving on. If there were 3 things that we could do, what would we like to do? I would like to make some suggestions to NHSX and NHS Digital, who are our sponsors, and make some offers of support, and also give them some use cases. So we're going to do that, and we'll write it up in a blog post. Mark, would you like to just talk about how we might be able to make the giving of data back more easier to happen, and how we might support that process?
Yeah, I'm not an expert on any of this, but the bit I'm kind of least an expert on is synthetic data, and I do wonder if we might resurrect some of that. Yeah. So I think from conversations we've been having, it's kind of boiling down into a few different things. So one is, there is something about giving the data back. So there's an industry about us in the NHS, and I'm sure in local government, saying lots of data off every day and not getting anything back at all. So it would be great to have the debate about whether we could have row-level data back, or pseudonymized data, or aggregated data, or anonymized data, or at least something. But we don't even have that debate. It just kind of goes into a pot. So that's kind of not helpful. The second thing, which I think we need to contribute to, and apologies, Peter, that kind of privacy schmivacy, but I think what you too often get reported is quite vague articles, and disappointingly in the Observer, where they go privacy concerns a bit, and they just say privacy concerns. Once they've said it, they think that's enough. They don't then say what they are, and they don't challenge them and say, I completely respect that if someone's had mental health problems or a penis enlargement, that they might want to protect that data. But there is a level at which most people are generally relaxed about their data being used for public good. And there's kind of emerging evidence that says that. And I don't think we do that enough. And I think there's some really interesting anecdote emerging. So some of you may know, Paul and I recently went on a holiday with a group of other people called COVID, and we had a very productive WhatsApp group where we shared all sorts of data amongst each other in a really helpful way. And I'd be well up for contributing my data into a bigger bucket of how I felt on each day, linking that to other people's data, benchmarking my sense of smell against theirs, but I also wear a Garmin. Very happy to share my heart rate from yesterday and how many miles I cycled and so on. And I think there's a piece of work perhaps with Stuart and others to talk about on the kind of technical side about how we link data from all sorts of devices, because people have made that quite difficult, like Fitbit and Apple and but it's not that difficult. We could actually stream it all and share it together, and I think that'd be really cool. So the first thing is kind of give the data back. The second thing, I think, is a big opportunity for sharing it. And I think the third one is challenging kind of existing business models that kind of protect data in quite an old-fashioned way, and hypothetically ordnance survey and others. And I think what's been really helpful over the last couple of months of Paul and the team putting these together is that it's helped us boil down these discussions into 2, 3, 4 kind of big visions for like a manifesto to kind of come out of this group. The last point I would make is that I said is that kind of local v regional one. So we're looking at doing some analysis of ethnicity beyond BAME. We need to get rid of BAME because it's kind of useless and people don't self-identify in that way. And I think we'll get the governance done within our hospital, but I don't want to have to go around the whole region and try and get everyone to agree because there wasn't enough time. I'll do that in time, but I'd rather just get on with something locally, get it done in my big hospital, link it to, Graham's got it done in a different setting and so on. I think that's a better model of lots of little people getting stuff done and kind of collaborating, that kind of conference thing about the small fish chasing the shark. I think that's really important actually, not to skip over, because what the IG people often say is, if you can get NHS Digital or X to agree, or the region to agree, then we're well up for it. But life doesn't work like that. Someone's got to be brave on their own and do it, and then kind of go and make friends with other people who've been quite brave. Trying to get everyone to agree is the kind of, unfortunately, the kind of centrist view of it, which I just don't think works.
Thanks, Mark.
Ranty.
Thanks, Mark. Yeah, that's good. Would anyone else like to make a point? Join in? This has been a bit more open session, discussion point. So Pete's got a point there he wants to make. There's a whole lot of people that I know are on the line that are either listening in or contributing. I think I'm up to 3 pages on my Zoom thing here. So please do make a point and join in either on the chat or the Google Doc. So Peter, yeah, over to you.
So I was just going to say on the privacy and information governance. So people have been talking with at local level, and myself, very happy to work with NHS Digital, PHE, whoever, to produce a DPIA, including producing that in the open, and to go through the UK government data ethics framework, whatever it's quite called now, because it's in the process of iterating, etc. But it's important to go through those things because they can help do things better. They're also part of engagement and openness and transparency, doing that openly. So people are more than happy to do that and work through that. That's also why the local authorities I know who are ready to go right now if there's data available. They would want to do that, and they want to start at an aggregated level to reduce some of those concerns and to start to see can they find value at that level without needing to get into anything more sensitive.
Cool. We've had
no one wants more scarce stories right now.
No. One of the questions we've got asked quite a lot, and we've reached out to the Nowcasting team via Future NHS, and I think we might get them to speak at some point, is around the local R value. And lots of people have asked for this local R value. And I really do think that there's an opportunity to start a conversation about generating local R values that make sense to people. And I think we're going to try and reach out to some of the I guess, more technical people within NHS Digital and NHS X about how that might be presented. Basically, the R value is a model. It's lots of assumptions. If the model was published, maybe we could find our own data to generate R values. and then to come to some consensus about what a reasonable number is. So using the science, but actually doing it in an open way. So we've got a request about, is there an open model for generating R values? And then that will drive us to help publish more open data. And then in our experience, doing it that way, we take a lot of the heat out of the question, because people understand the assumptions, the considerations, that things change over time, and that we move to a consensus about a number, which is obviously there's politics in that, but I think we should either collectively try and find those models and publish them, and then work together to do that. So that's something that's on my mind about how we become more open in that. But I wondered if anyone had come across the how we're generating those models and where we find them. Okay, so Peter's just said there that 13 models going to the national value. Yeah, I'd love to see the model, and that sounds a crazy way of publishing one number. So maybe I'm sure people are looking at generating them themselves anyway. Okay, so if there's no other points people like to make, this is like this is going to be a subset of what Open Data Saves Lives does. So local data for local people. How do we create local? This is real theme that's come out of Open Data Saves Lives. So we've got the publishing using data. We've got a governance theme that's coming through about actually challenging the data privacy. Okay, let's not do anything approach. But as Mark said, there's a lot of evidence where people are willing to share and do things a little bit more creatively, and a little bit more relaxed about that. If we can demonstrate it for, probably good for that. We've got sets of tools that are being generated. So we demonstrated our visualization tool, and we've also got people are building things open source. FutureGov Online, they've helped build one, and we're going to talk about next week. And then Beautiful Information in Kent, they've also built tools that they're using for their clinic and commissioning group in their hospital that could be shared open source and could be deployed there. So we've got tools as well, and then there's also the convening power of Open Data Saves Lives, because we don't own it. Other people could do Open Data Saves Lives sessions wherever. How we do that, how we build on that, how we create a community and an ecosystem around that. We might want a week off, so why can't we do that in Newcastle? There's no reason why people can't join in and share with that. So lots of real positive stuff for that. So next week is all about tools. We've got 3 people who are going to talk about that. So back to the more normal scenario of the session that we did last week, where we had 3 show and tells and then discussions and a collective hug about how it could be better. That's where we're at with that. And then if everyone's got suggestions for the further sessions, please do let us know. So there's the whole system cover model there that Nick's put in the link. So thanks very much, everyone. If there's no other questions or points, please do stay with us and join in, and we'll see you next week. And it's under the hour, yes.